Okay. Right. Thank you. Welcome, everyone. My name is Susan van de Ven. I'll be chairing this meeting today as a Cambridgeshire County Councillor. I'd like to begin by welcoming those members of the public and press who are watching the live stream of this meeting via the Cambridgeshire County Council's website. There is always a risk that we may run into technical problems, and I would ask for your patience if we do so. Should this occur, I will declare an adjournment while the fault is addressed and the public broadcast will be paused. If it is not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. And I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on Cambridgeshire County Council's website. Right, we'll move to apologies. We have received apologies from, sorry, I have to press continue to record. We've received apologies from Gary Howsam and Daryl Preston, and John Thomas, I see you're here, so we'll welcome you. May I call the names of the members of the board to establish your presence for the record? Thank you. Councillor Fitzgerald, I believe, is not here with us yet. Councillor Handley has given his apologies. Councillor Howitt, don't think is here yet, but is expecting to come. Councillor Walsh.
Yes, I'm here. Thank you. Good evening. Good afternoon.
Thank you. Charlotte Black. Don't think.
Apologies from Charlotte today, Susan.
Okay. Adrian Chapman.
Yes, present.
Thank you. Jyoti Atri will be coming in a second, I think. Lewis Camphor, I believe, is on annual leave.
Yeah, apologies from Louis, yeah.
Wendy Ogle-Wellborn.
Present.
And Jan, we've already called your name. And myself, Susan van de Ven. Thank you. Right. Does anyone, we'll move to declarations of interest. Does anyone wish to declare any disposable pecuniary interest or any non-statutory disclosable interest? No? Okay. Right, we'll move on to item 2, notes from the meeting on the 18th of June, 2021. We are being asked to approve the notes of the meeting on the 18th of June, 2021 as a correct record. Can I ask if anyone who does not agree with this proposal to use the raised hand function now? Okay. On that basis, the recommendation to approve the notes is carried. All right. We then come to item 3, public questions. I don't believe we've received any public questions at this time. Is that still?
That is right, Councillor van de Ven. We haven't received any questions.
Okay. Thank you. The next item is the update on epidemiology, but perhaps we might move the agenda around and go to item 5 with Lynn Rodriguez on the vaccination rate. Would that be all right with you? Lynn, are you still here?
But Lynn was here because nobody thought I was going to be here. Sorry for the confusion, Susan.
Not at all.
So I'll pick that up if that's okay.
Great, thank you.
Excellent. Okay, so good afternoon, everybody. So the vaccination programme over the last few weeks has continued at pace. So looking at the numbers now, we are over 75% for people with first vaccinations and over 58% for people with their second vaccinations. We have some pockets where the vaccination rates are high, and we have some pockets where the vaccinations are not where we would like them to be. That is the same everywhere across the country. The strategy for delivering the vaccinations at the moment is kind of three-pronged. The first one is that we are making sure that we have enough walk-in capacity and bookable capacity for anyone that wants to be able to walk in and have their first vaccine and then their second vaccine at 8 weeks, not before 8 weeks, but at 8 weeks and no longer than 8 weeks. So the mass options to walk in is one solution. The second solution that we are putting on is that we are putting on more local centres and smaller centres using areas like pharmacies in order to increase the capacity that we have, and that is people being able to walk into their pharmacist and get their vaccine. And the third element is that how do we take the vaccine to people? I'm sure Adrian will talk a little bit more about that, but that's how we're really reaching into communities, into employers and other places to take the vaccine to people as and when we can. Just to be absolutely clear, the issue with vaccines at the moment is not capacity. We have enough capacity, and in fact, we have a number of empty slots. It is also not availability of the vaccine. We have plenty of vaccine. Now we are on effectively the incredibly difficult piece, which is getting people who either haven't had it through a choice or for another reason that they didn't realise they could get it, making sure they come forward and have their vaccine. Just to give people some assurance though, when I look at the numbers, every cohort in priorities 1 to 5 is over 90%. Every cohort over the age of 55 is over 85%. And then we drop for the 50 to 54-year-olds to just below 85% at 84%. So we haven't got in those big priority cohorts 1 to 9 large numbers of people who haven't had the vaccine. What we are doing though is really pushing now the other age groups in cohorts 10, 11 and 12. The other thing that is happening at the moment is that we are preparing for what happens over autumn and winter for a booster vaccine. How does that work with the flu vaccine? And of course, we are starting to look at, as more information becomes available, how do we do our younger population of 12 and above? So that's the programme that as we have it now. I'm sure Adrian will want to talk a little bit more about how we're reaching into communities.
Right. Thank you very much, Jan. Would anyone like to ask a question at this time before we go on to Adrian's report? No, okay. Adrian, could we move on to yours? Thanks.
Thank you. Yeah, thanks, Jan, very much. So yeah, just to add a little bit of extra information to what Jan's already described, which is in overall terms a really successful programme with some big numbers. Everything now is captured on the most amazing website, thevaccinators.co.uk. I'll plug that anywhere and everywhere I possibly can, and it's really great if members of the board could promote that to communities. It contains all of the information in a really easy format on availability for the next couple of weeks of any and all vaccine clinics and walk-in provisions, as well as pre-bookable sites. It's a great place to look. The Vaccinators, all one word, .co.uk. And that is populated through some really great collaborative work that now is happening between the CCG, the wider health system, including CCS, the vaccine provider, and the local government system, and our voluntary sector partners. And there are 3 tasks really that group collectively has to deliver every week. The first is to sign off for the following 2 weeks, a delivery plan based on evidence being provided by our surveillance cell. Emmeline on this call is a key lead for that cell. So a 2-week ahead view of what vaccine provision should look like. And we're doing that to provide a bit of stability, but also to keep it quite live, because obviously the evidence changes. As Jan's mentioned, in some parts of the patch, take-up isn't quite where we want it to be, but we could quickly find that recovering at speed. We then want to turn our attention to another area where take-up isn't perhaps as effective. So a 2-week plan. The second weekly task is that we also ask our colleagues to identify additional sites for the next 5 weeks. So sites that perhaps haven't been used before, that where evidence suggests we might have a significant impact on a particular community or a particular place where, again, rates aren't as high as they need to be. And the third aspect of our weekly challenge to partners is to help us identify additional workplaces. Where can we take the vaccine to, which captures a particular set of employees that might fall within those more resistant groups, and how can we work with employers whom we're having some exceptional collaboration from, I have to say, to reach more and more people. All of this is facilitated through our vaccine confidence group, which meets every week, but we've also developed some exceptionally strong relationships with our district and city council colleagues. So this is me with my county council hat on now, talking about the best way of really delivering this programme has been proven to be through the very local knowledge that district and city councils have. I would say that every day of the week, but it's been proven through the course of this programme. And each district and city now has its own working group. The county council has a place on that, as does the CCG, as do our comms leads and the Think Communities team. And they're great ways of making sure we're drilling down into the granular knowledge that our district and city council colleagues have of the place and their communities. So all of this building up then to the Vaccinators programme, which is essentially the platform, the front door, if you like, of what's going on out there. And alongside all of that work, as Jan mentioned, we're doing quite a lot of proactive work to reach into communities that where there is evidence of lack of take-up for whatever reason, either through structural issues, so lack of transport or other factors, or where there is real confidence or hesitancy issue at play. So lots of work continuing with vulnerable groups, Black and minority ethnic communities, for example, that have been more adversely affected by the effects of COVID, by working with Gypsy Roma traveller communities on sites where they're based and where they're living, with victims of domestic abuse, for example. So a range of a dozen or so vulnerable groups that we continue to really work hard with and alongside through existing forums, and making, frankly, all available use of the connections we've got in our system to reach those groups in ways that make most sense to them. And overall, we're seeing the gradual, steady but solid increase in take-up across those cohorts, and it continues to be a positive story. And I think my message is that we should hold our nerve. We should continue to do what we're doing. What we're doing is working. Our kind of hand-in-glove relationship with the CCG is paying real dividends here, and the district and city council relationships too coming to the fore. We just need to hold our nerve now and continue to get to communities that are more resistant, and I think we've got the right ingredients to do so. So I hope that's a helpful summary, and happy as always to take any questions.
Thank you, Adrian. Would anyone like to ask a question at this point? You could use any kind of hand you wish. Not yet, okay. Oh, sorry, Councillor Walsh and Councillor Howard.
Thank you very much, Chair. It's not so much a question, really, as a comment. I think that this is great partnership working. I just wanted to say that. It's absolutely amazing how all these people have come together to deliver this programme. And I think it's so serious now, where restrictions have been lifted to get those people on board and get the vaccinations done. And that appears to be working. So just wanted to offer a thanks to all the people who are doing that.
Thank you. Councillor Howard.
We're now not allowed to call it first name at this call.
Sorry.
Firstly, I'm back from holiday, everyone. So nice to see. I'd like to add my thanks as well, and how important this is, and we should all keep pushing it. There was a particular problem in the city of Cambridge that you recall we were discussing at the time with the last Adults and Health Committee. How's that going? Because obviously people do ask us in relation to that. And secondly, it is always useful to hear these figures in the context of regional and national figures about how we're doing. So could you comment on that, please? Thanks.
Sorry, is that a question for Adrian then? Or Jan, perhaps?
Either the fields say know the best answer, I would guess.
I can certainly talk about the Cambridge effort and the Cambridge push. If perhaps Jan was able, I don't have the data in front of me, but I'm sure Jan will have and could perhaps refer to that. So certainly, you're absolutely right, Councillor. We recognised there was a deficit of take-up in Cambridge for various reasons. It took a while for us to truly understand some of the causes of that, and there were a lot of complex factors at play. What that led to is really a precursor to what I've described today, which is a very granular level of understanding and then application of solutions to a place. And we've been able to work really effectively with Cambridge City Council to ensure that we've got a wide range of flexible vaccine opportunities for people. So some walk-in provision in high street locations, some very targeted within communities, some engagement through VCS and faith groups, so some mosque-based provision, for example, where we felt that would be helpful. We had the benefit of, when students were in the city, of setting up some provision in King's College and working really effectively with Cambridge University. So it led to a really hardened effort on Cambridge and what we understood about Cambridge, and that has effectively been our pilot, if you like, for what we're now rolling out across the rest of the county. We have seen that impact in buying for time now because Jan's sneezing, but we have seen an impact on the numbers which have increased. We still need to keep going, and that's my reference to holding our nerve, really. Let's not take our foot off the pedal here. And Jan, I don't know if you've got the numbers, but it has been a positive impact. Yeah,
so if I can just talk in broad terms, because I haven't seen the numbers for the latest week, but out of the I constantly look at the data compared to how we are against the East of England. Of the 6 systems in the last 2 weeks, I think we've had the highest volumes of second vaccine uptake, but that is because, quite honestly, we were a tiny bit behind. Because we're always on a few weeks delay, as I said, that we have been before. So we are within the region now. We are, I think we're sitting behind Suffolk. What we have got is higher percentages in cohorts, which means that we've been more accurate than others in our total uptake. I don't have the latest national statistics to hand, but I'm very happy to get them and to make sure you've all got a copy of them, because I just don't have them to hand, unless Emmeline's got access to Foundry. They're in front of her and I don't. Sorry.
What I have got is what's on the national coronavirusdata.gov, which is based on NIMS, so I can add that to the slides I'm just about to share, if that would be useful, Jan. It's probably very slightly different to Foundry, but I'm happy to add that in, because that gives that regional and national comparison.
That'd be great, thank you.
Good, and thank you for that, Jan and Adrian. Just following on from Richard's question about Cambridge, am I right in thinking that a similar situation exists or has existed in Peterborough that we ought to ask you about?
Yeah, it's very similar. So our 2 main sort of cities, I know we've got 3 in Ely, but the 2 major cities have both had seen similar levels of take up, but very different causes. Very different demographic profile in each city, which has meant we've had to take our time and really understand what the causes might be in Peterborough, but similar approach in place, very flexible approach. We're now running vaccine clinics in mosques, again, different faith settings, community buildings, which we'd not done before. And again, we've seen a significant upturn in take-up. I should also say, actually, for both Peterborough and for Cambridgeshire, we've invested in a dozen or so community workers through our voluntary service partners who have been appointed from communities where perhaps national evidence suggests lower levels of take-up or lower levels of confidence. And they've been working really hard with communities in Peterborough and Cambridge in particular, but also in places like Wisbech, East Cambridgeshire, where a different approach might be needed just to help people understand the benefit of and the low level of risk of becoming vaccinated. That's also become part of our toolbox and an important part of it for that matter. So just thanks to our colleagues.
Susan, can I just add one thing just before we go on, which is we have seen a slight issue with some of the data, in that what we're finding is that obviously there is a difference between resident people who live here versus people who are registered with a GP here, and we've also found an issue with the data in terms of people who might be registered here but not living here currently. And so actually we've now got to do quite a large exercise around effectively cleaning all the lists that we've got to make sure we are using the right denominator on some of this. And I understand that has been a bigger issue for us in Cambridgeshire and Peterborough than other areas, and I suspect it's the makeup of our cities that are doing that. So I haven't seen the results of that yet, but if there are differences between all the numbers, there is that big cleanup that is being done to push that forward.
Thank you. Okay, any other questions before we move on, or move back, I think, to the epidemiology report? Oh, sorry, Irene, is that?
That's me, yes. It's just a quick question to Adrian about Peterborough and the question that you were answering about the challenges. And you mentioned the groups in Cambridge that you were particularly targeting. Are the groups basically the same in Peterborough, albeit the methodology might be different?
Broadly similar, and they follow the national pattern, but I'd probably say there's less hesitancy amongst ethnically diverse communities than perhaps one would have imagined to be the case of a city with such mixed demographic profile as Peterborough. We're seeing far less take up in young people, and that's a national picture. We're seeing more hesitancy in men than women, which is interesting. So a bit of work needed there. But overall, I think very similar overall trends. We are doing some nationality focused work, but it's far less present than we first envisioned it needed to be. It's much more about just getting the right messages out to all communities and finding ways actually to communicate with communities in ways that make most sense to them and that kind of demystifies some of this. So we understand really well in Peterborough how to reach communities whose first language might not be English. They don't often use traditional media sources, so we've engaged in WhatsApp groups, for example, and that's just made the world of difference. We're also doing quite a lot of door knocking now because a face-to-face conversation done safely has shown to be really valuable, 2 or 3 days ahead of a vaccine pop-up, for example, being started. And they're the sorts of things we're able to do, but broadly, yes, very similar theme.
Okay, thank you.
Okay, I don't think I see any more new hands. So could we move to the epidemiology report, which Jyoti's got on the screen here. Thank you very much, Jyoti. You may be on mute, but I can't see you.
Thank you. Sorry, my apologies. I had an absolute nightmare trying to get into this meeting today. I had to shut my whole computer down and start again, and it took ages. Anyway, I'm here now. So let's crack on with the epidemiology. So the first thing to note is the map of England. And the last time I shared this with you, the dark colours were further towards the northeast and northwest and London. And you can see now that it's spread throughout the country, leaving a nice little pocket on the east of England where rates are a bit lower than the rest of the country. The vaccination data for the country is showing that 88% of the population have had so that's 18 pluses, have had their first dose, and 70.3 have now had their second dose. And if we look down to the graphs along the bottom, in terms of the people that have tested positive, we saw a bit of a peak towards the middle of July, and now we're seeing rates come down, and I think they've come down for about the last 5 days in a row, and that peak may well be due to the euro effect, and we've yet to see the impact of the lifting of restrictions on the 19th of July, so that may come through in the next week or so, where there would be a lag between the lifting of restrictions and it showing on in terms of the numbers of people who test positive. Deaths remain low, but are increasing ever so slightly, with a slightly higher increase in the number of people admitted with COVID-19. Testing has stayed pretty stable, showing a slight dip towards the end of July, the July period covered there. So if I move to the next table, this is showing that for the weekly incidents for the previous 7 days, rates were rising across the whole of Cambridgeshire and Peterborough, with highest rates in Huntingdon at 405 per 100,000 for the whole population. But if we look at the provisional data, that's showing more of a mixed picture, with rates starting to decrease, and I'll talk to that a bit more when I show you the graphs. But if we look at the over 60s data, rates are particularly high so the rates are going up in all areas for over 60s, and are highest in Cambridge and lowest in South Cambridge. But rates for the overall population are quite low in Finland. They haven't risen as rapidly in Finland as they have in other parts of the area. If we look at the graphs, if we look at the all ages on the left, the yellow line is Cambridgeshire, and that was largely driven by the 18 to 25 population, with students being a big part of that, and that dip that we see there in the yellow line is probably due to students returning home. But then we can see other areas have consistently risen quite steeply, and again, that's probably a bit of the euro effect showing, and the drop is probably due to the fact that the euro effect has dropped off. I think it's likely that rates will pick up again as we start to see the impact of the lifting of restrictions. And then the graph on the right is showing, actually a bit more concerningly, that whilst rates are still low for the over 60s, they're consistently rising. So this is showing case numbers haven't quite got to the levels that they got to in January, and we're starting to see a reduce in numbers. I have to say that case numbers in parts of the northeast and northwest rose much higher than the figures that we've seen locally. So I'm just going to have to move the picture so I can see, and that's showing for Cambridge that the hook that I've already shown you, but the consistently rising rates in over 60s, which are around sort of 75, I think there. But if we look at the over 60s in Peterborough, they're much higher at just around 90 per 100,000. So rates in the over 60s are a bit higher in Peterborough than they are in Cambridge, and overall case numbers again are lower in this July peak than they were in the January peak. The last time I showed you these figures, the dark blue was concentrated around the 15 to 30-year-olds in both Peterborough and Cambridge. And we can see now that the dark blue purple has spread much higher into the older age groups up to about the age of 50. In terms of testing, we've seen that testing rates have stayed pretty stable for LFDs, with a small dip in recent days, perhaps due to a bit of testing fatigue, I don't know. But PCR rates have risen, and that's probably reflective of the positive cases that we've seen, the symptomatic cases who are actually taking up the PCR, and it's a very similar, so that was Cambridgeshire, a very similar picture in Peterborough. This is showing that hospitalisation rates are starting to they're still much lower than the January peak, as you can see here, but they're starting to increase, with 47 positive cases currently in our acute trusts. Deaths have remained low, and we've had one death in Cambridgeshire on the 17th of July, but no deaths since the 16th of April in Peterborough. And excess mortality is remaining low. We're not seeing any excess mortality due to COVID, as deaths have been low, as I've just explained. And deaths for other causes also remain low. So in summary, nationally cases are starting to go down, but I think it's a case of watch this space, because we've yet to see if there's been any impact because of the lifting of restrictions. Deaths are starting to go up, but numbers are still low and much lower than the January peak. There's higher rates across the country than we're seeing in east of England, and the rates in Cambridgeshire and Peterborough are lower again. But they've risen rapidly since May, and whilst the over 60s are lower than the national level, they are starting to rise. Testing rates remain stable, with an increase in PCRs since June, probably reflective of our higher positive case numbers. Hospital cases and deaths and excess mortality remain low. I'll stop there. Thank you.
Thanks very much. And I assume are you able to stop sharing your screen, and then we can all see?
There we go.
Thanks. I'm sure we've got some questions. If I might take the liberty of kicking off. I guess I have a question that's related to our comms and our responsibilities, all of us in encouraging good behavior, responsible protective behaviors and so on. The data, of course, concentrates on deaths and numbers of cases, but it doesn't tell us anything about long-term ill health as a result of the COVID cases that we do have, and risks to young people in that realm. And we're certainly hearing from our health partners that this is a really concerning issue. And I wondered where this report is useful as public information and as a public update, and especially considering the fact that there are some encouraging messages in the report. How do we convey the seriousness of risks, adverse, long-term health from the cases that we do have, and in particular for young people? Just wondered if you could comment on that.
Shall I start, and others may, Jan or others may want to comment? It's certainly been part of my messaging in my interviews with the media. I have been careful to point out that the Delta variant is new. We haven't had it. We haven't got a long history with it, and we don't know. Whilst it's circulating mostly in the young people, and it's unlikely to result in high levels of hospitalisation and deaths in that population. We don't know about other long-term consequences, for example, post-viral fatigue. What proportion of those young people who have been infected will then suffer from post-viral fatigue or other long-term consequences. long COVID, or, you know, the long-term consequences are a matter of national research, and there isn't at the moment a clear definition, and it looks like there's several syndromes associated with long COVID, and I think we need to wait for the outcomes of that research so that we've got a clear case definition, and then can carry out surveillance on our local population against that clear case definition. But it's certainly something that I've been using in my messaging to support vaccine uptake amongst young people.
Okay, thank you. Are there any other questions from others? Sandy.
Great, thank you. Yeah, Gigi, can I just ask, you mentioned about long COVID, just reminds me of a question that we had submitted to us from a member of the public around the medical provision and the understanding of long COVID and associated syndromes. And I don't know whether this is a question maybe for health colleagues, but I'm just wondering kind of like the speed. I'm just a bit worried about if there is a lag, what provision and understanding is there for something that's could be quite a complex, difficult medical situation for both clinicians and for patients, and if there's much advice out there.
Looking, are you, Jyoti, is that something you want to?
I mean, I don't know the details, but I do understand some of our trusts have set up long COVID clinics. I don't know if Jan knows any more.
Thank you,
Yeah,
Jan.
so we've had national funding. We've set up a small amount of long COVID clinics that have been run out of Addenbrooke's, but run for the whole of Cambridgeshire and Peterborough. I think the point Jyoti makes is the right one, though. We don't quite understand what long COVID really is yet. We don't understand what that definition could be, and so actually there are various different routes that people are taking in, and until we know more, and unfortunately that's going to take time and work through those clinics, we're not in a position to kind of clearly define it. So we've got clinics in place that is learning, but I think we're all waiting on more of that research to come out to give us even more of a guide for where to go.
Okay. Thank you. Sandy, is that, you happy with that? Richard.
Thanks. I'm sure we've all got our own views about government guidance around so-called Freedom Day and so on. And I don't know how much we've got, as partners, we've got flexibility in setting our own tone on the public messaging. I guess the CCG might be more constrained than some of the rest of us, but to the degree that we have got flexibility, I would argue that we should be preaching more caution. You know, anecdotally, all I see is people being completely back to normal. I'm not seeing much social distancing. I'm seeing a big reduction in mask use, and because I have late teenage children, I see young people completely oblivious, really. Even though, again, anecdotally, in their friendship groups and wider circles, there are increasing incidences of COVID. And so to the degree that we can do it, you know, I would argue that we should be stressing the personal responsibility aspect of continuing to be cautious and to practice social distancing and mask wearing, to get tests if you need to, and to isolate if you need to, because I think a lot of the national stuff about pandemics and freedom days is very, very dangerous. But I appreciate this is a partnership, and I don't know what flexibility we've got, but that is my view for what it's worth.
Yeah, Jyoti.
Yeah, that's certainly the messaging that I've been continuing with in any of my interviews with the media. My team have been involved in producing a plethora of guidance to support workplaces, events, the council itself on what we do, care homes, for example, what we do post the 19th of July, which has pretty much emphasised the the desirability of continuing with measures as they were pre the 19th of July. So that's certainly the push that we've been making.
But that does lead very nicely on to the last agenda item, which perhaps unless there are other questions, perhaps this would be a good moment to move on to the comms report. Would that be, would you be agreeable to that, Richard, to carry on? I have a question too. I think we'll do that in the interest of time. Move on to item 7, unless there are any other questions. Okay, Christine, over to you.
Hello, yes. So that it's, oh, can you hear me?
Yeah.
That obviously the campaign messaging that we revised and developed of doing the 19th, which was all looking at the messaging of this depends on us. Getting to the next stage depends on people getting their vaccines, testing, observing all the public health messaging. As the dates changed, as we knew that it looked like we were going to move towards the 19th, we've been refining the messages with our partners across the whole of the public sector through the Warning Informed Communications Cell, and based on all of the behavioural science information that we're getting from and so.
Christine, we're having a little trouble.
Oh, sorry, is it difficult? Shall I?
You want
Let me take the video off.
There we go. Yeah,
there we go. That's a bit better. Yes, sorry, you can either see me or hear me. So we've revised and relaunched the campaign, which is called the Do the Right Thing. So I think very much what Councillor Howard is saying, which is actually no relaxation really of the rules, although making the point that whilst people don't have to by law do some of these things, it is absolutely imperative that we all think about doing the right thing for ourselves, for our communities, for our own families. So this information, we started with a push, and I think I've sent around the outline strategy to you all to review that. And we also have a very detailed daily activity plan, which started from about a week and a half before we got to the 19th, the lead up. And we did quite a lot of work with our regional partners, all the leaders of all the councils across Cambridgeshire, Peterborough, Essex, Suffolk, Norfolk, and all their DPHs. We put together a joint release. We've also then put together something at the beginning of last week with all the leads of the public sector, the Chief Fire Officer, Police Chief Constable, the Mayor of the Combined Authority, all again picking up on those messages about, yes, you can, but should you? You need to think about doing the right thing, keeping to all those public health messages, but also ultimately getting your vaccination, doing your tests, and isolating if your tests seem positive. So that is what we've been doing. We've also been reaching out and working, as we have throughout this whole last 18 months, with our community representatives. We have a lot, I think we were talking about vaccinations a bit earlier on. We have scripts every time something changes. We have scripts that we work with all of our community champions. We have now videos which are on both County Council website and the Peterborough City website, and we're sharing with all our district and our voluntary sector partners, talking about vaccinations in I think about 12 different languages. We've also got now, I think 3 at the last count of messaging around, whilst the relaxations have ended, why you should continue to do the right things and what the right things should be. All of our messaging is based on showing people the positive things that they can do to do the right things, because everything that we can see through research is that whilst you can scare people into doing things a little bit for a while by showing people the bad outcomes, and indeed we have used case studies where people have had quite bad outcomes, that tends not to work, and particularly doesn't tend to work with the younger age group. What you've got to do is show them positive and helpful ways that they can live their lives sensibly and happily and able to do the right things in a way which suits them. Otherwise, they'll be scared once and then they forget. So we're very, very dependent on getting a whole series of people who are happy to speak. And I think we've got, Jyoti has done a lot of interviews. We are working with all our members, but we also have a number of case studies lined up. We have a number of initiatives that we're working with all our public sector partners to take the media in. We've got a very good agreement now launched with the Archant series of titles, which is 6 titles across the whole of Cambridge and Peterborough, who are running a whole series of articles for the next 4 weeks. BBC Radio Cambridgeshire, who have got a dedicated reporter who's going to be working on sort of bringing some of these stories to life. All of the other publications, all of the printed titles, as well as all the social media activity that we're doing, all of the poster work we're doing, all of the very targeted stuff we're doing around geolocate and working, as Adrian said, through WhatsApp groups, through community groups, using their own networks. We are using all of those, and we are having a sort of theme every week through the summer. This week's theme is about families and what families can do to do the right thing. Next week, I think we're focusing on business. The week after, we're going to switch to particular messaging around clinically extremely vulnerable people, and then we'll be working into a back to school, back to university type messaging. So that is what we're doing at the moment. We are very, very dependent on getting those good case studies out there, because we can say it as councils, or it's very useful if we've got doctors and firemen and policemen saying it as well, but actually there is nothing which works as well as people's own personal stories, and that's what we found quite difficult to come up with. So again, a plea for members to continue to push the messages, and we're putting out a toolkit every week for people to use the messaging and put it out. But actually, if you come across people who are happy to talk about their own experiences, we could really use them.
Thank you. That's an important message for those of us who are counsellors and working in our communities. Does anyone have any questions for Christine's report? Sandy.
It's more a thank you, actually. So we're very pleased to be involved with the Warm and Informed group. We continually look for case studies, so we will keep looking, Christine. But people, some it is, I'm sure you appreciate it's just personal, and some not everyone wants to, but we will keep looking. But thank you for your toolkits, and we're really pleased to be supporting those across our network.
I wanted to ask a question, if I may. I guess trust is at the heart of all of this, getting people to engage with these messages, and it is difficult to talk about trust sometimes when we see double standards around us. And looking at your the comms coming out that you're making available on your social media, I find that it's difficult to use all of it because I need to balance it out with all the other things that residents rightfully expect from me. So it really needs to be inside a mix of all the practical things that we are there to serve residents on. And I would say, drainage and potholes are of unending concern. And if we only talk about COVID, people stop engaging. And I notice that, and I don't know if that's something you could comment on. And in terms of young people, and you mentioned that people might be scared once and then forget about it. I mean, now is such an important time for young people, and the risk is in front of us. So in addition to do the right thing, my instinct would be want to warn and inform more than just asking them to do the right thing. But I'm not an expert. But like Richard, I've got I see young people in our family life, and I'm always thinking, how can I get my message through? And it isn't easy. So yeah, are you getting pushback or feedback from your strategy? What do you see in terms of public reaction to your social media messages?
We get we get very good engagement when we're using personal stories. So we get a fair amount of engagement when we're doing our normal toolkits. You might have noticed we've moved to sort of animated ones. The most recent ones, you can see little video clips of people washing their hands, and that seems people like things that move. So we've got quite a lot of engagement with that. We get very good engagement around things which are more fun. We're working with Suffolk County Council. They've done some nice video work around, one jab is only half the job, very much focused on men, many of whom they were noticing. And I think we're starting to pick this up, and it was based on some of the national information that we got, was that men were having their first jab and then not bothering to get the second one because they were feeling sort of a bit macho about it, or it hurt, and they didn't want to go back and get the second one. So quite a lot of their quite amusing videos is about, doing half a job, only doing half washing the car, half mowing the lawn, just to make things a little bit more shareable, a bit more amusing. So we're trying to use a mix of things and see what works. But I completely get actually some people want to get on with normal life. So we are getting, and some of the capacity issues we have about doing more and more COVID stuff, and we're continuing trying to work it into our business as usual. But there is a lot of business as usual. People want to be getting on with their normal life. They're interested in potholes and what's going on in their communities, and education, and what the A-level results are going to be, and all of those sorts of things. So it is sort of doing that and trying to weave those messages in subtly where we can.
Thank you. All right. Any other questions for Christine at this time? No? Okay. I think that brings us to the end of the meeting, and I'm sure it'd be fine to finish a bit early, although let's see, any other business? Do we have any other business? No. Okay. In that case, we'll just note that the date of the next meeting is to be confirmed, and I'll declare this meeting closed. Thank you all very much for coming and for all that you're doing. Thank you.